Welcome to Case Stories by Dr. Josie. That's me, where you get to hear and learn stories from the hospital. Today I'm going to talk about fibroids. It's a highly requested topic, and I'm going to discuss the nature of the fibroids, which people are prone to getting fibroids and what can be done to the fibroids, and also what complications it brings, whether you're pregnant or whether you're not pregnant. So what's a fibroid? A fibroid is a tumor that develops in the muscle layer of the uterus, and this tumor is usually not cancerous. The chances of it changing to be cancerous is very minimal. It has been estimated that 20% of women at the age of 30 years have got a fibroid in their uterus, and out of them 50% remain asymptomatic. This means that 50% of women that have fibroids do not have symptoms. Also, black women have a higher chance of getting fibroids as compared to other races. So what are the causes and what are the risk factors that are associated with fibroids? One is infertility, and also not giving birth or not siring a pregnancy, what we call nulliparity. Also, increasing age. The more you age, the more you have a higher chance of developing a fibroid. Ethnicity, as I've told you, there is a twofold increase in African American as compared to white women. Also, increase in obesity increases your risk of developing a fibroid. And also, if there is a family history of, so women in your lineage have been having fibroids, that is also a risk factor. And also a hyperestrogenic state. This means that a state that promotes estrogen levels to be high in your body. The fibroids can develop in the uterus anywhere. It could be anterior, it could be posterior, it could be lateral. It can develop anywhere on the uterus, and it can also involve the cervix. They're usually, when they develop, they're usually multiple. It's not rare that you find a solitary one, but most of the times they develop in multiple numbers. Also, they are firm. That is when you palpate your lower abdomen, you can be able to feel them as firm nodular feelings. Also, they tend to have a spherical shape, and even if it's not a perfect circle, it may be lobulated, but it will still lean towards the spherical shape. Also, they can be large. They can get even up to more than 15 centimeters in size. And when you're visualizing it as a medic, when you're visualizing it in the uterus, it can be easily removed, what we say easily enucleated. Once the fibroid forms in the uterus, it can undergo different changes. It can calcify. This means it can become hard as stone, usually what is called a womb stone. Yes, it's usually called a womb stone. It can also die. That means it can also reduce in size, especially in postmenopausal women. Remember, I told you estrogen supports its growth. So once you reach menopause and estrogen starts to decline, the size of it, you may find that it reduces even without medical intervention. It can also undergo necrosis or start dying from the inside. It can also be infected, especially after either delivery, birth, or abortion. These things can introduce pathogens, and hence it can be infected. It can also undergo vascular changes. This means it can grow vessels just like any other body tissue in your body. What does it do to the uterus once it develops? So fibroids, they distort the shape of the uterus. That is why mostly fibroids are associated with infertility, because it is disrupting the structure of the uterus. Also, it may cause failure of ovulation, and this will also bring about changes in your menstrual cycle. It's only symptomatic in 30% of patients. Symptoms depend on the location, the size, the changes it has undergone, and whether if you're pregnant or not. So these symptoms can be heavy bleeding. It could be very painful cramps, also infertility. Also, it can bring about pain while performing intercourse, can also cause recurrent abortions, can also cause lower abdomen or pelvic pain. A pain that you can tell is not in the stomach, it's not in the gut area, it is lower. And also it can cause abdominal enlargement. Remember, I've told you they can grow up to over 15 centimeters in size. So they can grow such that they protrude from your belly. So when you're pregnant and then you have fibroids, what usually happens? So one of the things I've told you is recurrent abortions. You're not able to hold a pregnancy because one, it's distorting the shape of the uterus. Also, it can make you go into labor earlier, what we call preterm labor. It can also cause growth restrictions to the fetus because it's like they're competing for space. Also, we can have pressure symptoms. This means that the fibroid is causing pressure onto other organs. So it can cause pressure symptoms to the bladder, such that you feel like you want to go to the washroom for a short call so many times, and you're wondering, and when you go, it's just a little amount. It's because the fibroids are pressing on the bladder, making you have this frequent need for urination. Also, if you have a tumor in the cervix, remember I've told you the fibroid can be in the uterus or in the cervix. If you have a tumor in the cervix, it can bring about abnormal vaginal discharge, bleeding, and also pain during intercourse. What happens if you have fibroids during labor? This may happen. Remember, sometimes women with fibroids have gone through a full-term pregnancy with minimal or no complications, but here we're learning about what can happen. Has to be vigilant. So one, the uterus can refuse to contract at all, meaning you don't go into labor at all. You can also cause malpresentation. This means instead of the baby turning and coming out with the head, they are not able to turn because there are a lot of obstructions in the uterus. So the baby may come out with either foot first, the bum first, any type of malpresentation because of the presence of fibroids in the uterus. Also, it may cause obstruction of the birth canal. So you're pushing, you're in labor, but it's not really progressing because there's an obstruction by the fibroid. It can also cause excessive bleeding or heavy bleeding after birth, what we call postpartum hemorrhage, which is very dangerous. Complications when you are not pregnant. So this is what usually happens, heavy bleeding. This heavy bleeding causes anemia. So a person with fibroids may not necessarily know that they have fibroids, but they'll come to the hospital because they have anemia. And what are mostly the signs of anemia? Blurry vision, mostly feeling tired, heavy breathing, and these are the things that are bringing you. It's because you've been losing a lot of blood over a period of time, leading to the anemia. Also, it can cause urinary obstruction or bowel obstruction because of the presence of it physically being there. Fibroids are non-cancerous, but there's a minimal chance that it can also grow into it being a cancer. So how do we manage the fibroids? First, we have to diagnose them. We do lab findings, so we want to see if you have anemia. Want to do imaging. Mostly an ultrasound is very nice in visualizing the fibroids. So we want to see how many are they, where are they situated, are they, how big are they, have they undergone any changes? Remember, I've told you they can calcify. And the treatment will depend on your age, if you're pregnant, if you have a desire for future pregnancy, the symptoms that you have, the size and the location. So the treatment will be dependent on how the fibroids are presenting. So your healthcare provider will be the one to advise you better on how you go about it. But basically what usually happens, so the fibroids is either in the uterus or in the cervix. So one, if they're not symptomatic and they're not bringing about complications, we can observe them. So you're having regular checkups. If it's bringing about changes, they can be removed without removing the uterus. And sometimes the whole uterus and cervix can be removed in fully. So with fibroids, I think the biggest presentation is usually the heavy bleeding, and if they're too large, they can protrude outside of your belly. They may also be a major contributor to infertility. So this is advice to any women. Any presentation of abnormal bleeding, seek medical care. Any presentation of abnormal swelling of the lower abdomen, also seek medical care. That is all I have on fibroids. If you have any more questions, any lingering questions, drop them down below. I'll be happy to answer them. Ciao.